Good morning, friend. Today we are going to talk about the upper limb. Its overview. It will be an overview about all the things present in the or we are going to study for the upper limb. That is osteology, musculature, nervous system, arterial system, superficial and deep venous system, and cross-sectional anatomy. One by one, I am going to give you the overview of all these things. So first of all, bones of the upper limb. The upper limb basically consists of 32 bones. Among them, two are the sesamoid bones. So you can see the shoulder, that is scapula and clavicle. They are going to form the shoulder. Scapula is this part which is blade shape, which is a flat type of bone in clavicle. It is key-like in shape. That's why the name clavicle is given. It joins to the sternum and to the acromion process of the scapula. Then in the arm region, there is only one bone, that is humerus. You can see the humerus. Then in forearm, there are two bones, radius and ulna. Radius bone is towards your thumb side when you are standing in the anatomic position, and ulnar bone will be towards your little finger side. And then in the hand, there are carpals, 8 carpals, 5 metacarpals, 5 phalanges, and sesamoid bones. These are the sesamoid bones. You can see sesamoid bones. I think everybody knows that these are not typically the bones, but they are ossified muscular part only. Next, we'll talk about the muscles of the upper limb. So this is shoulder region, arm region, forearm region, and hand region. And everywhere certain groups of muscles are there for a particular type of motion of movement. One by one we'll see it. So this is the muscles of the shoulder region. As you can see, on the anterior side first we'll see the anterior side. So there is subscapularis. Wait, I will just remove all this and again I will come to this. First is subscapularis muscle. It is one of the rotator cuff muscle. Then teres major, serratus anterior. Serratus anterior is serrated muscles which are present on the whole of the rib region towards from the back side of the scapula itself. Then there is subclavius. Subclavius, as the name suggests, it is below the clavicle. Then there is pectoralis minor and pectoralis major. Pectoralis major is a fan-shaped muscle which is going to help you with the different movement of the pectoral region actually. We will talk about these muscles in detail in some other video. On the posterior side, if you see, there are supraspinatus again, teres major and infraspinatus. So these three will be the part of rotator cuff muscle. You can see from the posterior side, they are attached to the medial bottom. Then there is rhomboid major and rhomboid minor. They are directly attached from the medial border to the spine. Then there is latissimus dorsi. This is one of the biggest muscle and is also the muscle which connects the upper limb with the lower limb. And levator scapulae, as the name suggests, it is going to elevate the scapula. Then deltoid, the contour of your arm, that is deltoid muscle. And then the trapezius, which is overhauling muscle of all the region, starting from neck to mastoid, then neck, then to the all of the lumbar region, and it get connected in the scapula. So these are certain names of the muscles. Here we are only going to talk the names only. Detailing will be done in some other video. Then comes the muscles of arm region. So there are anterior compartment and posterior compartment. Anterior compartment, there are three muscles: coracobrachialis, brachialis, and biceps brachialis. So biceps brachialis, as the name suggests, it is two-headed, and this is the muscle which is maximally doing your flexion part. On the posterior side, there is tricep. It will have three heads, and it will be the uh, muscle which is against the muscle of bicep brachii or antagonist. Then comes the forearm compartment. Forearm compartment, there are too many muscles. They are divided into three parts. Superficial part, there is pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi malaris. The superficial compartment is also called as flexion compartment, and you can see all the muscles have one common origin point, that is medial epicondyle of the lower part of the humerus. Then comes the intermediate compartment. In the intermediate compartment, there is only one muscle, flexor digitoris superficialis. This is very big muscle. As you can see, these tendons are going to the middle phalanges, till middle phalanges towards and connecting again to the middle condyle, epicondyle of the humerus. In the deeper part, it is called also called the extensor compartment of the forearm. There is a flexor digitorum profundus muscle. Again, you can see digitorum, wherever you find, you will see it is going towards the digits. And flexor pollicis longus, that is going towards the pollicis, thumb side. Then pronator quadratus, which is in the helping in the pronation and supination. So these are the muscles which are present in the forearm, posterior compartment. Then coming towards the hand, posterior compartment now. Posterior compartment, this is called the extensor compartment also. So there are extensor carpi radialis longus, extensor carpi brevis, extensor digitorum. Again, you can see digitorum, it means it will go to the digits. Then extensor carpi ulnaris, digita minimi, and cuneus. And then in the deeper compartment, there are again a group of muscles is there. Extensor indicis, supinator, adductor pulsus longus, extensor pulsus longus, and extensor pulsus brevis. These are some group of muscles which are present on the posterior side of the forearm. Next comes the hand. In hand, there are three compartments: deep compartment, thinner compartment, and hypothinner compartment. Thinner compartment is towards the thumb side, hypothinner will be towards the little finger side. You can see dorsal interosseous, palmar interosseous, adductor pulsus, and lumbricals. Then there is opponent's pollicis, flexor pulsus brevis, and adductor pulsus brevis. These are from the thinner compartment. And for the hypothinner, you can see everything will be connected with the digita minimi or the little finger. The opponent's digita minimi, adductor digita minimi, and flexor digita minimi brevis. You can see some names, there are longus and some are brevis. The longest means which are longer in the length, and brevis simply means they are shorter one. So shorter one actually they are mostly in the palm region, and longer one are coming from the forearm region. Again, there is a big chart about origin, insertion, and function of these particular muscles, group of muscles, but it will be not in this video. Then the nerve supply of whole of the upper limb is basically from the brachial plexus. Brachial means arm, plexus means network of nerve. The ventral rami of spinal nerve C5 T1 innervate all the muscles of the upper limb, excluding the trapezius, which receive directly from the cranial nerve number 11, which is very important question. These rami branch out to make a complex interconnection, forming a network like brachial plexus. Brachial plexus itself is a very big topic, and it has been described in other videos which are already present in my channel. C5, C6, C7, C8, T1, then they will form the trunks, divisions, cords, and from cords several branches will be there. So if you see the structure ventral rami, you can see C5 and C6 are going to form the upper trunk, C7 will be the middle trunk, C8 and T1 will be the lower trunk, like this. Then they are going to divide into two parts, anterior and posterior, both all the trunks. Then they will form the cords, lateral cord, medial cord, and posterior cord. And then there will be certain branches, and ultimately there will be terminal branches. So this is how the systemic arrangement of brachial plexus could be understood. You see again, ventral rami, trunk region. In trunk, you can see superior trunk, middle trunk, and inferior trunk. You have to note the root values C5, C6, C7, C8, and T1. Then you can see divisions. All will be the anterior and superior, posterior division. Then for the cord formation, you can see there are three cords. Lateral cord will be formed by the anterior divisions of both superior and middle trunk. The posterior cord will be formed by the all of three posterior divisions of superior, medial, and inferior trunks. And the medial cord will be formed especially from the anterior trunk of the inferior trunk. And then they will form the branches, which are numerous branches actually. So you can see lateral branch, medial branch, and then ultimately there will be certain terminal branches, which will be described in next slide. So as you can see, axillary, it innervates the deltoid, teres major, and iliacohumeral joint. Median nerve, it innervates most of the anterior compartment of whatever flexor compartment we have studied, and most of the lateral hand muscle. Musculocutaneous, it will supply or innervate the anterior compartment of forearm, that is brachialis, coracobrachialis, and biceps brachii. Radial innervate all the muscles which are present in the posterior compartment of both arm and forearm, like triceps and all the extensors of the forearm. And ulnar, it innervates the flexor carpi ulnaris, half of the flexor digitorum profundus, and most of the intrinsic hand muscle. Means whatever lies on the side of little finger, it will be innervating most of them. And then there are certain other muscles, nerves, which are especially for some specific muscles, like dorsoscapular. It is going to innervate the rhomboids and limited scapulae. Lateral pectoral, it is for pectoris major and minor. Long thoracic is very important. It is for the whole of the serratus anterior muscle, which is big muscle. Medial cutaneous will be for the, as the name suggests, skin of the medial arm. Medial cutaneous forearm will be for the skin of medial forearm. Medial pectoral will be for the pectoral minor and some part of major also. Subclavian, as the name suggests, subclavians. Subscapular will be for the subscapularis and teres major. Subscapular will be for the subscapularis. Suprascapular will be for the supraspinatus, infraspinatus, and thoracodorsal will be for the latissimus dorsi. This whole group, what we have talked, is called the brachioal plexus and its branches, and it's a very good question for the longer one. Then comes the vascular supply or arterial supply of the upper limb. So you can see artery is always remain same, but just the name is going to change as the reason. First of all, the main artery will be the subclavian artery, as the name suggests, subclavian. Then it crosses the clavicle and becomes the axillary artery in axillary region. Then it gives several branches, especially you can see it is divided into three parts, and all three parts are going to give total 6 branches. First part will give first branch, second part will give 2 branches, and third part is going to give the 3 branches. Again, this is just an overview, so we are not going to go in detail. So axillary artery gives supplies to the shoulder tissues, and circumflex humeral artery, which is one of the posterior artery, which goes to the again to the shoulder tissue. It crosses the teres major muscle. These are the milestone and becomes the brachial artery. Brachial artery has superior and inferior ulnar collateral arteries and profunda brachii. Profunda is deep. Then the profunda will give supply to the posterior arm of the tissue and ultimately becomes the radial artery, and superior and inferior ulnar collateral will become the ulnar artery. Radial artery, thumb side, ulnar artery, little finger side, remember. Then these are going to form palmar arches, superficial and deep palmar arches, and ultimately digital arteries, which are going to give supply to the digits. This is the systemic review of the arterial supply of the upper limb. Then comes the venous drainage. Venous drainage will be opposite. So you can see there are two, superficial and deep. Superficial one, as you can see, hand tissues will go to the radial vein and ulnar vein. They will go to the brachial vein, axillary vein, and subclavian. So this is for the deeper one. As you can see, this is radial vein, ulnar vein, brachial vein, axillary vein, and ultimately drains into the subclavian vein. If we talk about the superficial one, so there is only one specific changes. Radial vein and ulnar vein are again here, but there is one cephalic vein. Cephalic vein is very important, which is towards the superior side, and then there is a basilic vein. Basilic vein is towards the medial side, so like this. And there is one connection known as medial cubital vein. This particular vein, which is medial cubital vein, this is very important clinically. It is a part of cubital fossa. Then other are similar, like brachial vein, axillary vein, and subclavian vein. So there is this little bit difference between the superficial and deep. And the thing which you have to remember is cephalic vein and basilic vein and their connection, that is medial cubital vein. Next part is cross section. Cross section is important to understand whole of the anatomy. So you can see this is a cross section is taken from mid arm, right side, superior view. The anterior compartment muscle, if you see, it is brachialis, coracobrachialis, biceps, long head, biceps, short head. Blood vessels, if you talk, brachial artery, basilic artery, cephalic vein, median nerve. For posterior compartment, triceps, long head, triceps, medial head, tricep head, because only one muscle was present. Then musculocutaneous nerve, radial nerve, and ulnar nerve. So this is how we can understand the cross-sectional anatomy of arm. Then for forearm, too many muscles are present, as I already told to you. The muscles for anterior compartment, you can see flexor carpi radialis, flexor carpi ulnaris, flexor digitorum profundus, flexor digitorum superficialis, flexor pollicis indicis, longus, palmaris longus. Then for posterior compartment, adductor pollicis longus, extensor carpi radialis brevis, extensor carpi ulnaris, extensor pollicis longus, brachioradialis, extensor carpi radialis longus, extensor digitorum pronator. For vessels and nerves, radial artery, ulnar artery, basilic vein, cephalic vein, median antebrachial vein, ulnar veins, median nerve, radial nerve, and ulnar nerve. So this particular cross section which we have seen, it is from the mid forearm right side and superficial view. So this whole thing comes to the end for the overview of upper limb. I think will be very beneficial to just summarize all the components, anatomical components related to the upper limb. Thank you very much.